Oral medications, I did document all the oral medications given and all the topical ointments given, the eye medication and the ear medication. And now we're going to go on with the enema, and as soon as I'm finished with that, I'm going to go on with the suppository. Okay, so first I'm going to check again my reports, my the medical, the MAR, with the Cardex to make sure that they both state that an enema has been ordered. So I show Stephen Tyler, enema, the time, and so I do the 5 checks to make sure enema has been ordered. It has been ordered. So I'm going to wash my hands and put on my gloves, and then I will check. Are you Stephen Tyler? Okay, and yes, he is Stephen Tyler. I'm going to put him on the left Sims position, in the left Sims position. Okay. I've got my enema bag ready with the enema tube. I am going to do a double check again. The second check is Stephen Tyler, enema, time, dosage. So I did the 5 checks the second time, and then I did check he is Stephen Tyler, and then I want to just check for the 3rd check, and he is Stephen Tyler, enema is ordered, and yes, the time, the drug, the dosage, the route, so they all are checked. I got my enema bag. I am going to fill it with 100-degree water, and I am going to release the air. I'm going to unclamp the enema tube to release the air out of the tube. And I'll reclose that. Okay, so that is ready. I have my paper down to protect the bed. I'm also going to take lubricant, and I'm going to squeeze. Okay, that would have been disinfectant, but that would have been unsterile. But so I'll hang on to that. I will take the lubricant out and put it onto a paper towel, the lubricant, making sure that I do not touch either the tube or the end of the tube or the lubricant with my fingers. I will rub the lubricant onto the tube. I will instruct the patient. I am giving you an enema. I will be inserting a tube up here in the anus, up to 4 inches. If you could just breathe deeply, I will insert, lifting up the buttocks, I will insert it 4 inches into the rectum, into the anus, until I hit the sphincter. And once I have the tube in position, I will release the clip, and I will make sure the bag is 12 to 18 inches above the patient while I slowly install or let the fluid flow into the patient. It'll take 5 to 10 minutes. I will continue until the patient no longer can hold anymore. When that is done, I will lock the tube. I will reclip the tube, telling the patient again to continue to breathe in and out. Take deep breaths while I remove the tube. I will take a clean paper towel, and I will clean up any of the leftover lubricant. I will ask the patient to hold the buttocks and try to hold as long as he can for 5 to 10 minutes, holding it together to keep it closed. Okay, and then I will remove my gloves, and I will wash my hands, and I will document that I did the suppository. I did the enema. Next, I will do the suppository. Again, I will do the double check. Stephen Tyler, drug. I will do all the 5 checks to make sure that the suppository was ordered. Then I will recheck it again, the second check, make sure that it's all ordered. I will wash my hands. I will put on a new pair of gloves. I will check with the patient to make sure he is Steven Tyler. Yes, he is Steven Tyler. Okay, I will put down a new paper towel to make sure to protect the bed, and I will again ask him to be on his left Sims position. I will remove his pants. Sticky. Again, I have a sterile paper towel and my lubricant, and I will squeeze the lubricant onto this paper towel, and then I will get out the suppository, making sure I do not touch the end of this suppository with or touching the lubricant. I will put lubricant on the tip of the suppository. I will tell the patient I am going to be entering the suppository into your buttocks. I will lift up his buttocks to tell him to breathe. Breathe take deep breaths. I will insert the suppository up into up to the sphincter, and I will slowly release my hands, asking the patient to continue to squeeze his buttocks together to try to until the urge of wanting to release that takes place. And then again, I will take a clean paper towel and I will wipe the patient. I will remove my gloves and wash my hands, and I will document the suppository was given.